Okay. Please can I welcome everyone to this meeting of the Economy and Housing Policy Committee on Tuesday, the 26th of November, 2024, from the Walton Suite, Winchester Guildhall. The time is 6:30 p.m. My name is Councillor Batho, Chairperson of the committee. Some housekeeping points before we start. This meeting is being recorded and will be available on the Council's YouTube channel following the meeting. Can everyone please ensure mobile phones are on silent? And in the likely event that it is necessary to evacuate the building, the fire alarm will sound. Please follow all the instructions given to you by our team. Can I welcome everyone to the meeting this evening? And turning to the agenda, the first item is apologies and any deputy members. Matthew, I don't believe we have any.
Thank you, Chair. Members, no apologies, Chair, and all members of the committee are present. Thank you.
Thank you very much. And on to the second item, which is declarations of interest. Have we anybody that's declaration of interest before the meeting starts? No, thank you very much. Item 4, chairperson's announcements, none of those this evening. And then on to the minutes of the previous meeting held on the 17th of September 2024. And can I ask if these are agreed? Agreed. Thank you very much. We don't have anybody in terms of public, but I know that Councillor Horrell was intending to come to speak on both items of 6 and 7, but is not here at the moment. So we'll just move on straight to item 6, which is the Disabled Facilities Grants Policy Review. And this is a presentation which is going to be introduced by Councillor Westwood. Thank you.
Thank you, Chair, and apologies for breaking the mic there. There we go. Good start. Thank you for the opportunity to bring this policy review before the committee this evening for comment. The Disabled Facilities Grant is a mandatory grant to assist towards the cost of eligible DFG works necessary to support people of all ages and most tenures to live independently and safely within their own home. Local authorities have a statutory duty and powers to provide DFGs to applicants who qualify. The current DFG policy was agreed in March 2023 and made significant changes to the policy adopted previously in August 2019. The amount of DFG the Council receives has remained the same over the last several years, and yet the Council has seen an increase in DFG applications received and approved. Previously, the Council has had yearly underspend of DFG and built up a reserve. The Council is now spending its full allocation in using the reserve fund to meet customer demand. Should the customer demand continue and the DFG funding remain unchanged, then the Council continues to operate within its existing policy, current DFG funding will be spent by the financial year 27-28. The Council will then be in a position of not being able to meet the needs of all approved applications and revert to holding a waiting list again. This presentation outlines options to change the DFG policy, ensuring that the funding can be better used to meet the needs of more of our vulnerable residents within the District of Winchester and ensuring best value for money. We're looking for your views and comments on the options proposed before you this evening to revise the DFG policy and before it's finalised and taken through Cabinet for decision next year. So at that point, I will hand over to Karen Thorburn, who will take us through a presentation, and then Karen and I will be delighted to answer any questions you may have.
Thank you, Councillor Westwood, and thank you for that introduction. Have the next slide, please. I've always wanted to say that. I'm just going to do a little bit of an overview for you. Councillor Westwood kindly has started that. Especially if you're not familiar with the Disabled Facilities Grant. So Disabled Facilities Grant comes from the Housing Grants and Construction and Regeneration Act, and the funding actually goes directly to central government, which then goes to Hampshire County Council, which then comes to Winchester to City Council. It's a capital grant which is available to people of all ages in all private sector housing tenures. However, it isn't for Winchester City Council tenants. They would have to be funded through the housing revenue account. The purpose of the Disabled Facilities Grant is to enable eligible disabled people, and eligible disabled people is defined by the 1996 Act, to continue living safely and independently for as long as possible in their own home. In 2015, the funding of the DFG has come through the Better Care Fund. This supports a wider agenda of integrated approach to health provision, recognising the importance of housing provision in the whole sort of holistic offer. And at the bottom, there is a link to our existing policy, and I think we do have Wi-Fi now. So if you do need to have a look at it, please do so. But it is quite a long document, but it's just there for your reference. So how does it work operationally? So an application is made to the council, and that can be made either via Hampshire County Council or directly to Winchester City Council's Housing Occupational Therapist, who I have on my left here, Mandy Cox. The legislation states that an applicant should have been assessed by an OT or a trusted assessor to ensure that the works are necessary and appropriate. And it's really important that those works are necessary and appropriate to meet the client's needs relating to their disability. And that doesn't exclude also people who may be autistic, have a mental health condition, a physical disability, learning disability, cognitive impairments such as dementia, and progressive life limiting conditions such as MS. Works include, but are not limited to, level access showers, straight and curved stair lifts, ramps, wash dry toilets, through-floor lifts, etc. And actually, the most adaptations that we do are wet rooms, so that they contribute to a significant amount of the grants that are approved. The application then passes to our grant officer, and we have 3 grant officers. So Lewis here is our senior grant officer, who will ensure that the works are then reasonable and practical. So the OT assures that they're necessary and appropriate, and then the DFG officers assure that they're reasonable and practical. The grant officer has to take into consideration the condition of the property. The costs of works are proportionate to the need. So there are times when we'll have some very difficult conversations with our residents about whether or not moving is actually a better option. At all times, we inform the applicants of the decisions, and we do inform the applicant that the actual final scheme of works may differ from the initial referral that we receive. And there are many cases where a family may want a 2-storey extension to start with, but by liaising with us, we're able to meet the family's needs by just doing a 1-storey extension, which also means it costs less and the money can go further. Next slide, please. Thank you. I forgot to do that after the last slide. Sorry, Matthew. So why do we need to review the DFG policy? So the council needs to review the current policy to reflect the budget and increased demands. Over the past 4 years, applications have increased, more grants have been approved, but the average cost of works have increased, but the grant allocation has remained the same. And if you look at the graph, you can see the really bright red line, the number of applications has increased significantly over the last couple of years. And you can also see from 2021 that we didn't spend anywhere near our budget compared to the money received. But if you look at 24-25 in our current position, they're nearly equal, and we've still got 5 months to go until the end of the financial year. We're able to sustain that because we've underspent in the last previous years. But going forward, if we continue to receive the level of applications that we receive and we don't have an increase in the budget, if it may be that we see a decrease next year if Hampshire County Council decide to keep some monies back, and if the cost of works don't decrease, then we are going to, by about 27-28, run out of money if we keep the existing policy. We've had an increase in applications, I think, for many reasons. I think people want to try and stay in their own home for as long as possible now and stay independent. I think there's greater awareness of our grant, but I also think we have a very generous DFG policy at the moment. So we've gone through 3 options that we would like you to consider and comment on. So can I have the next slide, please? Thank you, Matthew. So option 1 is that we keep the existing policy. So we've outlined the advantages and disadvantages. So the advantage is that we would be able to assist all eligible residents of the district regardless of financial means. So at the moment, anybody can apply for a DFG and qualify for £15,000 regardless of their financial capabilities or situation. It would be quicker to administer the grant applications because you wouldn't be doing means testing, talking to them about contributions, etc., etc. However, what are the disadvantages of now keeping this policy? There is a high risk, as I've just mentioned, of the DFG budget not lasting for the full financial year, and the council may have to delay mandatory grants, and then we could be in breach of our statutory duty. The council is at risk, for not fulfilling the better fund care requirement, so we need to keep people out of hospital, and people need to be discharged from hospital as quickly as possible. The council would be in a position of holding a larger waiting list, and many have already gone through the Hampshire County Council OT waiting list before we receive those. Number 4, the use of limited public finances to fully subsidise adaptations to those households who have their own financial means. So the DFG at the moment, the DFG funding, potentially does not reach those greatest in need who do not have the means to pay for their adaptations. And also, if there are delays in adaptations because we run out of money and we see a larger list, there is a greater risk of residents remaining in their homes that are unsafe, and then this could lead to higher hospital administration, higher care costs, and potentially family and carer breakdown, because it can be very stressful for a carer or family to care for somebody, especially if the house doesn't have the home doesn't have the proper adaptations. So the impact here is the council might be able to fulfil its existing policy with the current level of funding from central government, but we don't know what that funding is going to be from 25-26. And talking with our colleagues at Hampshire County Council, it may be that they now don't give us it all and they may run some services themselves. So we're still unsure about that. So that's option 1, that we don't do anything. Next slide, please, Matthew. Thank you. Option 2. We means test all applicants and we stop all top-up grants. So at the moment, somebody can have a top-up grant to the value of £100,000. Pre-March 2023, there wasn't a cap on that top-up grant. So when we changed the policy in March 2023, we brought the cap in at £100,000 because some applications were coming in at £400,000 and £500,000, which was half of our grant allocation. So at the moment, somebody can have a grant of up to £100,000. So what are the advantages of means testing all applicants and stopping all top-up grants? It's likely that the council will be able to keep within the full DFG budget. It would be quicker to administer grant applications. The council will remain working within the guidelines of the Better Care Fund. The council's DFG budget would go further and help those more in need. However, the disadvantage is there is currently the data to know whether or not we would spend our money in full. Because we don't currently means test, we don't know at the moment of all the applicants that get the 15,000, how many of those would or wouldn't qualify, because we don't actually do that at the moment. So the removal of the discretionary amount could result in some residents not continuing with their adaptation. So if we said we will pay 30,000 and it costs 40,000, they may not have the 10,000 to make up that shortfall, which means we wouldn't be able to do the adaptation. If we decided to means test, it could take longer, but that's something we would need to work through because we haven't always fulfilled the requirement of means testing. If we remove the top-up grants, it may be that eligible applicants can no longer have their home adapted, or they may not be able to stay in their home. Majority of our top-up grants involve children, if I'm correct in saying that, and we do on average about 5 a year. So if 5 times 100,000, about half of our budget goes on top-up grants. And then finally, some applicants may be assessed after means testing to have to contribute, but they may not have the difference, as I've just mentioned, which means they wouldn't be able to have the adaptation at all. So the impact is the council would ensure that they're supporting eligible residents most in need and without the means of funding themselves, but we wouldn't be able to do any scheme over £30,000. So, thank you. Next slide, please, Matthew. Option 3. Means test all applicants, but allow a discretionary grant and revise the top-up grants amount. So, in short, it's sort of what we would like to do is allow a discretionary amount. So those that just fell over, not qualifying, would still be able to have the works, and allow a top-up grant of enough to at least maybe have a new kitchen and a wet room, or a little bit of more of an adaptation than the ramp and through floor lift and the wet room. So the advantages are by reducing the discretionary grant, say for example from 15,000 to 5,000, we would expect a number of applicants now to contribute towards their adaptations. By reducing the top-up grant, for example, from 70 to 30, this would enable necessary adaptations to still take place and enable applicants to remain safely in their homes. We feel with this option that the council would still remain working within the guidelines of the Better Care Fund, and we feel that the council's DFG budget would go further and help those more in need. The disadvantages are that if we reduce the discretionary grant amount, this may result in some residents not continuing with their application. And it could take longer to administer an application if we're doing a means test. What we do find occasionally is once we start asking residents about their financial situation, many aren't comfortable in providing that to us, so they withdraw their application in full. The impact is this would be a balanced approach, helping eligible residents, but ensuring that the DFG budget is managed effectively. So, thank you. Next slide, please. So the next steps. So that's really the last 3 slides put into a table for you there. So the next steps, if we were to go forward with option 1, we would just continue as we are. Our policy does allow us to halt top-up grants at the moment. So whilst we were getting our budget position correct, we did halt top-up grants for about a month. That didn't actually impact any residents. So to enable us to get a true position of our finances going forward. Option 2, the next steps would. So for option 2 and option 3, really, the next steps is we don't know what the impact would be because we don't do it at the moment. So what we're asking really, or wanting to consider, is if we go ahead with option 2 or option 3, is that we carry on our current policy for a year. We have enough money to do that, but then we run dummy policies alongside that to gather the data. So we wouldn't actually implement the dummy policies, but we would be able to gather the data to understand how many of those that receive the 15,000 now wouldn't going forward. We could think it's 35% and it could actually be 75%. How many of those families would we no longer be able to assist with the top-up grants? Because say, for example, we decide a figure of 60, is 60 enough to cover the cost? So we don't have that data to really understand the impact of what option 2 or option 3 would do. However, the officers feel that it's not sustainable to carry on with option 1 in the current economic climate, where those £15,000 can go to any household and therefore may not be able to reach our most vulnerable residents in the district of Winchester. I've rattled through that, sorry. I've also, before I take questions, I would like to thank Mandy and Lewis to the left of me, because they've worked really hard in getting the budget together, talking to other local authorities. I'm really just the spokesperson tonight, so thank you for your help. Thank you.
Great, thanks, Chris and Karen. Councillor Westwood, like to.
Yep, thank you. Karen, would it help if we just explain the difference between the mandatory and the discretionary grants? Because I don't think that quite came out. Well, I certainly missed it if it came out. But what is the difference between mandatory and discretionary? I understand the top up and you covered that, but just so everybody understands the difference.
I will try my best, but Lewis, and are you happy to? Thank you.
I think I've got it right, yeah. So the mandatory grant is a maximum of £30,000 per application. On the sort of basic level, we would do a means test to work out if each applicant would need to contribute towards those works. In certain circumstances, if a person is in receipt of a means tested benefit, they would be passported through that means test and could go through to get £30,000 on the application. Is the same for a child case. The discretionary part comes in where we decide to disregard that that contribution, or as it is at the moment, we don't means test and we just provide everyone with £15,000 straight away towards their works. So basically what we're saying is the discretionary is wiping off what someone would owe, and we're covering that with the DFG in the first instance. Did that answer the question?
Thank you. I suggest that we just sort of break this into a couple of parts maybe. And if there are questions about the section that sort of introduces the disabled facilities grant, in clarified sort of questions as Councillor Westwood has done, you can ask those and not actually talk about the options at the moment, but just anything about the actual numbers and about how the sort of policy has been working in the past, if we can do that. Councillor Eve?
Yeah, I was just wondering for a bit of context. In the graph, a lot of information. I was wondering, is there any further breakdown of the reason for cancellations? Is that on our side, the council side, is that tenants? Is there, yeah, just a bit of more info on that?
So generally the cancellations will be from the applicant themselves. So they will be deciding that they don't want to have the works done. It's too much work for them because in some circumstances, like level access shower, it can get quite noisy, dusty. It's a lot of work to be undertaken. Typically within the cancellation numbers, what we won't record there, and it's something we probably need to record in the future, is when we get a referral through and we're saying that it's not actually grant fundable work. So that's not something that I think we actually have the figures on at the moment, but generally those cancellation figures are someone saying they don't want the works done anymore. Thank you.
Sorry, just while we break, Councillor Horan, I know that you had asked to speak for this paper. Are you still wanting to do that?
Chair, apologies for my late arrival. I was detained somewhere else. I'd love to, but I appreciate you're in the middle of this, so I'm absolutely in your hands as to whether that's allowable. Thank you.
Yes, if you want to make your comments now, that'd be fine. So, Matthew, is that okay?
Thank you, Chair. That's really kind. And I just had a couple of questions really about the proposed policy changes. And I think we all know, those of us who've been looking at this area for some time, that it is a hugely important part of the work that we do, and allowing people to stay in their own homes with the appropriate facilities as opposed to having to have some institutional options put to them is a great thing to do. The one thing I realised, this is just a presentation today, Chair, but I was sort of seeking some of the data points almost, and there was an inference, I think, on the previous speaker, not only about the number of specific requests that we've had relative to our budget, but the sort of the spread of those. You know, what is it that people are really needing? And obviously, you're looking at changing levels of spend. So just to get some size of the price, what are we dealing with? Have we got 100 at 10, or have we got, you know, 1 at 1,000, so that we can just really understand the nature of those requests to us at the moment. So that would be really helpful. I understand completely that we want to give the best benefit to people, and therefore means testing is a very obvious way of ensuring the fairness of that. I take on board the options, and I think one of the options seems fairer than others. But again, to better understand the suggestion that you're making about the maximum amount that you would give, those amounts, because I'm not sure we all understand, unless other councillors have that knowledge about what we're buying. What is it that would now stop happening versus what we're able to do now? So just to get some understanding of that, I think would really help us all to embrace the need for change. And I'm not refuting that the policy does need to be adapted and broadly available, but just understanding what we're committing to. because clearly we had a policy a few years ago. Then it was changed somewhat. We've obviously got a slightly different outcome than the one we were expecting. You're looking for further change, accepted, but just to make sure that we understand the types of opportunities that won't now be available to people. And also, I think you just, Mr. Thelen, you touched on the sort of rules, those who are referred, and if for some reason we're not able to support them, the impression or the understanding that people have of that, so that that they're not surprised that there is visibility, transparency, Chair, on what we as a council are able to do. Because this is transformational for some people, this money absolutely transforms their lives, and makes for a better outcome for them. But if for some reason we can't do that, then clearly we all need to have clarity about what is in and out of scope, as it were. So I get the principle. It just would be helpful to have some of that clarification, Chair, and I really appreciate you letting me ask those questions. Thank you so much.
Thank you, Councillor Horrell. If we carry on with the questions that we have from the members of the committee, I think Councillor Murphy, you had a question?
Yes, and again, it's probably drilling a little bit into the data, but it's one particular thing that struck me through it is that we're obviously, there's a social good and we're trying to encourage people to make adaptations to be able to stay in their own home, and whether there would be any benefit to not means testing up to a lower point, say 5,000, which might allow me and simplify the process. Keep a simple process for the small adaptations, which can be life-changing, but actually then having a above that level kicking in with the means testing, because if you're means testing and it's a relatively small amount, it could be quite off-putting.
Thank you, Councillor Murphy. Yes, so when you look at the Better Care Fund and listen to Mandy's expertise, we feel that its ramps and stair lifts are the most crucial to enable discharge or to prevent admission into hospital. And so here, for example, I've just got some figures. A straight stair lift on average is about £4,500 at the moment. A ramp is on average just under 10,000. So what you might think are simple adaptations are still quite expensive. We've been liaising with our neighbourhood authorities, and for example, East Hants allow the first 13,000, New Forest allow the first 10, but Test Valley and Eastleigh don't allow anything. So this is why we don't have the data at the moment. So we've been talking amongst ourselves and thinking, okay, if we allowed the first 5,000, what could that provide? Well, you can see it doesn't need to provide a ramp. If we did 7,000, what we can't do most probably going forward is carrying on doing the 15,000. So we haven't got the figure yet of how much we would allow us to be discretionary. That's what we want time over the next year to work through to make sure that whatever changes we do have the best impact on those that are most vulnerable in our district. Does that help at all? Thank you.
Councillor White.
Just wanted to clarify about how you decide about the discretionary grants. So is it if the works are going to cost more than the 15,000 for the mandatory, then they can get a discretionary grant? But also I think I read somewhere if someone has a sudden change of circumstances or sudden maybe a stroke or their condition gets worse, then they can also get a discretionary grant because it's quicker. Is that right? I wasn't entirely clear.
Thank you for your question, Councillor White. So the discretionary grant part, if we try and sort of represent it, is typically the first part of the grant. So what we're saying is that if you, for example, had a £5,000 contribution, we would give you a discretionary grant of £5,000 to cover your your contribution, then the mandatory grant would then kick in over the top of that, up to £30,000 to pay for whatever the rest of your works would be. So at the moment, the first 15,000 is the discretionary part, and then over 15,000 is the mandatory part. Then what's the second part?
Oh, yeah. It's about whether
Oh, okay, yes. So
sudden change in circumstances or.
the legislation states that there is no maximum amount of applications that someone can make. So if we did works for someone, we would usually expect them to last 5 or 10 years. If their situation did change, we would expect them to be assessed by an occupational therapist again, and what their needs would be, and then they could apply again if necessary.
Sorry, can I, so if a prime example is somebody if they've got motor neuron disease, for example, so they come to us and we do say a stair lift, their condition will deteriorate. So then they will come back to us and they will then, have a bathroom, they may have ramping, they may have a wash dry toilet or something, but they can keep coming back to us as their condition, because a lot of the problem is that people have these conditions and they don't accept that they've got these conditions that they're going to get into. I mean, motor neuron, I think people are a bit better at that now. It's been quite a lot of publicity. So that the other thing that we haven't mentioned, and it is a little, just to confuse everybody a little bit further, if we means test them and if we means test everybody and then somebody is assessed as having a contribution towards their works, they can still proceed with it and contribute to that work. But if they have another grant, we don't ask them to pay that contribution again. So, and I think the legislation says that lasts for 10 years. So I had previous cases I've had that people have done that. They've needed something, they've paid their contribution towards the first grant, and then they haven't had to contribute towards the other part. The advantage of that, of course, is that we are also managing the works for them, and so that they know that they're not going to get, hopefully, ripped off by anybody. And could I just go back whilst I'm talking, because it's me that usually goes out and does the initial assessment. And so if we aren't, there will be people that because of the contribution aren't able to move forward with the grant, but by putting in some kind, and we're not saying that what we want to work out is what the contribution and discretionary part of the grant should be. And if it was say £5,000, that's the figure we're kind of thinking about at the moment, that would cover most people for the necessary things to keep them out of hospital. So we've met our better care funding obligations, which is to keep people out of hospital. And our thinking of also is that if somebody has a bathroom is typically coming in about £8,000 or £9,000, for them to find £3,000 towards that is a lot different than having to find £9,000. So some charities are really good, the MND, MS Society, they're really good at that sort of thing, or local charities. So we kind of felt that is a much more manageable amount, and also, but it does mean that we can monitor it more. I don't know if that helps.
Councillor Miller.
I can see why we've got to look at the options. Obviously, there's a limit to money, but the trouble with option 2 and 3 are that you can end up with effectively putting pressure elsewhere on the system that we don't do it. So somebody has to go into a hospital or some other provision. I mean, is there any way we could work with other organisations so if it makes sense for them to give us money, we could still top it up in a different way so that we didn't cripple the NHS with a lot of people going to beds that they wouldn't need to, their house could have been modified.
Thank you, Councillor Miller. We do explore all options, not just adaptations. So we do have a conversation about moving, especially if they are a social tenant and they're eligible to go on Hampshire Home Choice, because there may be already adapted properties that become vacant. So we have an aids and adaptations panel that meet every month where we discuss people that need adaptations but maybe can't adapt their own home, especially if they're a private tenant, because the landlord wouldn't necessarily give permission and their security might only be for 6 or 12 months. Mandy and Lewis and the team work really closely with SAFA, the British Legion, charities, exactly to do that. So if there is a shortfall between what we're able to pay and what it costs. But unfortunately, there are some households where they will fall between the gap because we are only able to give a certain amount. So say, for example, we've got a top-up grant of 100,000, but the works are 120,000. We can't, unless it's really exceptional and with Councillor Westwood's approval, we can't go above that 100,000. So it doesn't always mean the work won't happen. We just have to revise the works. So, for example, we had a case where the family felt and were adamant that they needed a 2-storey extension, which was coming in at £400,000. With surveyors and working with the family, we were able to half that and still meet the family's needs. So the discussion doesn't end when we don't think we can't afford it. We will explore other options, but there will be some families where that adaptation may not be able to go ahead due to monetary factors. Thank you.
Councillor Morris?
Yes, regarding the graph on page 6 with the sort of projection of the applications rising year on year and the budget remaining the same. Tonight we're being asked to look at the policy for next year or ongoing into the future, because if the applications continue to rise, the shortfall between the budget and the applications is going to go up year on year indefinitely into the future. So are we being asked to set a policy just for 1 year and then you come back again and we decide again? Or is this a policy we're putting in place where, as the applications goes up, you start modifying the criteria of the means testing, whatever, to make sure that you continue to remain in budget?
Thank you very much, Councillor Morris. We're confident that we can continue as we are for a year because we have a substantial reserve, but that reserve isn't going to carry on. So what we're asking for is a year's grace to consider option 2 or option 3 so we can get the data, then to come back to Housing Cabinet Committee maybe this time next year with a proposal for a policy. Most probably 2 to 3 years, but I would take guidance from my director and corporate head and cabinet member regarding that. But also we will know hopefully after Christmas how much our allocation is, because at the moment it's really hard because we don't know our allocation. So we're confident we can run this policy for a year, because our policy allows us to halt top-up grants if we need to at any time due to financial reasons. So if, for example, we're inundated with applications in the next year regarding top-ups, our policy allows us to stop that anyway and just allow it to carry through the mandatory grants. Does that help, Councillor Rice?
It does. This is effectively, this is open to change, basically, depending on if the income from central government increases or gets decreased. The whole thing could be changed anyway. Thank you.
So with the budget, there was more money put aside for stable facility grants, but as of yet, we don't know what that's going to look like and how that will trickle down to us. It could be that we would get a bit of extra money, or it might be that we don't get anything. So, and that new amount from 2025 onwards, again, we don't know what that's going to look like. So we are in a bit of an unprecedented situation of not being able to sort of predict too much into the future with our budgets, unfortunately.
Thank you. And a question for myself, just in terms of, or picking up on what Councillor Horrell was asking, there's also been an increase in the number of applications that we've had over the last few years. What areas have those been in, and what value has been the sort of most common sort of allocation that we've actually then had to contribute to?
Thank you, Councillor Bethia. I thought Mike get asked that, so we have a little chart. Yeah, so Lewis will answer, but we did predict that would come up.
So when we've gone back and looked over this, we were last financial year we did 69 level access showers, averaging about £8,000. We did 30 curved stair lifts, averaging about £6,000. 22 straight stair lifts at almost £4,000, and 20 ramps at £8,000. Then we had some other work, which unfortunately our data didn't go down deep enough to be able to split that up. But this financial year so far, we've completed 29 level access showers, 15 curved stair lifts, 8 straight stair lifts, 5 ramps, 2 wash dry toilets, 1 through floor lift, 2 ceiling tracked hoists, and 11 other miscellaneous works. And also, as we're only partway through the year, as it stands at the moment, we've got 38 level access showers waiting, 1 curved stair lift, 9 straight stair lifts, 4 ramps, 2 wash dry toilets, 1 through floor lift, 3 ceiling track hoists, 1 major build and extension, and 11 others. So quite a lot.
So of those, what's the largest value that we have allocated money for the last 3 years?
So I can answer your question in a different way, if that's okay. So I've tried to break down our grants under 30k, which is our mandatory grant amount, and grants over 30k, which is our top-up grants. So if we start back in 2021, 2021, 42% of our grant amount went to grants over 30%, and then 58% were grants under 30,000. So kind of almost 50-50 in that field. Then we had 21-22, 68% of our grants were under 30k, 32% over 30k. Almost the same again in 2020 and 2023. 23-24, 13% of our grants were over 30k, 87 under. But this year, so far, because the way that a lot of these works go is they're approved in 1 year and carry over into new financial year. So we have that knock-on effect of it being approved, but then comes out of a new budget. We currently got 43% of our grants over 30k and 57% of our grants under 30k.
So quite a significant proportion is actually over 30,000.
Yes.
So disproportionately, then, will there be fewer? Will it be able to do fewer installations in that figure over?
Yeah. So that 43% is 5 cases, and then the 57% is 85 cases.
I think this does demonstrate the point that we need to change the policy. Thank you. Councillor Ashwell.
Thank you, Chair. I've got 2 questions. One is really the understanding of it. As I see it from your chart, the budget for DFG is about 1.3 million. And you're talking about on the top of it is the top-up grants. Now, the top-up grants, does that eat into the DFG itself, or do you have a different budget for top-up grant? So why call it differently? That's one question. And the second is drilling down the data that you have presented. Number of applications for 24-25 is much less, or they're completed much less compared to 23-24. Would you be able to speculate? I know you don't have the data, and I hear that. Would you be able to speculate what the difference was between the last year's and this year's completed applications?
So to answer your first question, there technically isn't a separate account for the DFG and the underspend. However, I have been speaking with finance about doing that in the future, whether we could finance our top-up grants from there, and if there are any contributions that would go back into a sort of holding account for the underspend, and then the mandatory grants being run out of the purely 1.3 million minus the mandatory grants that someone's entitled to. So that is something we are looking at. Your question about the applications being higher.
They were completed, applications completed 150, I think, in 23-24, while application completed in 24-25 is about 80. What had changed?
Yeah, to be honest, I don't know. So we get referrals directly to us from the Winchester City Council website. So someone can do their own referral for themselves, and that would typically be where Mandy would go out and do an assessment. But we also get referrals through from Hampshire County Council, and they come from various different ways. They could be from a GP, through the hospital, district nurses and things like that. So I guess it really depends on that side of it as well, to see where they are trying to push people, and we just don't have that detail, unfortunately, at the moment. Sorry.
Could I just add there that the graph for the applications for this year only goes up to October, so we still have 5 more months. So we are anticipating that the applications and approvals will be higher. Thank you.
Councillor Murphy.
Just a question about getting comfortable with the change. I mean, at the moment, are you feeling constrained in any way in terms of how you market this and sort of push it, because you've got this limit on how many you're on your budget? And do you think this change will mean you could do more, or actually are you feeling comfortable you are getting this message out to people generally that grant that this money is there?
Thank you, Councillor Murphy. I do feel that most probably our residents in Winchester don't realise they can qualify for £15,000 at the moment, despite us publicising it and it being on our website. However, it's getting a balance, isn't it? Because if, say, somebody's got £1 million in the bank, they can still qualify for £15,000 at the moment. So if we bring in a means test and they then can pay for their own adaptation, we hopefully will, we might not do any more, but what we might do is reach more people in need, more vulnerable people, more people who haven't got the financial means. But at the moment, until we can have that time to assess the data, hopefully this time next year, we will be able to answer that question more accurately. Is that okay? Thank you.
Councillor Taylor. Thank you, Chair. It's my question, I guess, sits across all 3 options. So presumably there's obviously internal checks and balances that we do with any application. Indeed, you've kind of alluded to some of those in the answers that you've given tonight. So outside of the means testing, is there any other sort of changes being proposed tonight in terms of how we assess applications across any of the options, or is, how would we assess them consistent otherwise across all of the options that are presented tonight?
The assessment wouldn't change at all. Somebody would still make an application to the council. I would do an assessment and then explain to them how the grant works. And it's not unusual for people to say to me when I go out, do I qualify? So some people may have already done their homework. Some people just don't expect it to be a kind of grant that they get and so are entitled to. So I don't personally feel that it will impact or stop us doing stuff or change what we do. And as we've said already, we'd either look for other ways to enable them to help. But bear in mind, if they fail the means test or do they have a contribution, they've got some money somewhere. So therefore, it's not unusual for me to have another conversation to say that money is your rainy day money, and this is your rainy day, and therefore, you feel you are entitled to spend it. So yeah, I think we'll be able to help them as well through, we've got lists of contractors that we can help them do stuff through, and so it shouldn't really, it'll be their choice really if they decide not to go forward with it.
Councillor Morris.
Thank you. When councillors are considering this, they might be sort of tempted to think that they should prioritise the policy which does the most good for the most number of people with small interventions. But I would possibly characterise the ones who need the greatest interventions, the ones who are in greatest need. So I'd ask Lewis, when you do works which are over £30,000, could you characterise the nature of the works and possibly the nature of the people who require them?
Councillor Morris. Typically, works over £30,000 would look to be an extension of some description, usually for a child case. So we're trying to keep them in their home with their parents on a ground floor, typically a bedroom and probably a bathroom as well. Those really at the moment are anywhere from £100,000 upwards. So it's quite a considerable cost. But we do work closely with Hampshire County Council also. So there have been cases where we reach our limit of £100,000 and then Hampshire County Council will pay towards those works as well to top that up. So it's not a complete no. Once we hit our limit, we go back to the Hampshire County Council OT, have those conversations. They take that to a panel and see if there's further funding available there. Obviously, what they will consider is the potential knock-on effect of what care might have to be put in place if we don't do those works. And then they might decide that actually investing in those works is better value for them than putting in a care package, for example.
Thank you.
Just wondered, I think, Karen, you mentioned that you'd taken some soundings from other councils. Within that, have you also had any conversations about the impact of means testing on those other councillors if they've gone from, as we've gone from, yes, sort of having contributions to a means test? Is there any way that we can sort of get a gauge or an idea of what the impact on the applications might be by putting that in place?
Thank you, Councillor Bathay. So I used to work at Eastleigh Borough Council, so I still have contacts there. The difficulty being that council seems to be a rather different demographic to what we are. From last year, we did 105 owner-occupier applications, 39 social landlord tenants, and 7 private tenants. When I spoke with Eastleigh, they were completely the other way around. Majority owner occupiers, the majority social tenants, some owner occupiers, and then a small amount private tenants. And then when I spoke to my colleague there was not as many people that were turned down from the means test as we thought they would be. But I think what they have done anecdotally is they have conversations earlier on before they get to the means test of whether someone would probably be able to get grant funding or not. So it's more of a softer approach there. So we couldn't have reliable data to be able to compare, unfortunately.
I think also it's worth mentioning that because we're a stockholding authority, about 5,000 of our households don't qualify for disabled facilities grant, whereas in Eastleigh they don't own their own stocks. So social housing is registered providers who do qualify for disabled facility grant. So that's most probably why there's a significant difference in our numbers. I mean, I've previously worked at Test Valley Borough Council where there is no discretionary and there was 30,000. And if the works came over 30,000, the household would have to find an alternative solution, whether that be moving through the housing register if they could, borrowing money from family, or that the work just couldn't take place.
Thank you. So if we can just move on now to the options themselves, are there any questions about option 1 as a standalone option? Clearly, it's an option that is not being recommended at this meeting, but are there any questions that raises from the members of the committee? Okay, move on to option 2 then. Are there any questions directly about the specifics of option 2? Councillor White.
It's just about the logistics of means testing and the admin. It says potentially it would take longer to administer an application and means test. So, and is there a staffing cost and what kind of delays might you expect?
Thank you, Councillor White. We've had this conversation internally and we do have 3 staff now, whereas 18 months, 2 years ago, we only had 1 disabled facility grant officer. So we have increased our resources. I think it swings in roundabouts, really. So the officers are trained in means testing. They are doing it alongside the current policy now. I mean, I don't want to speak for Lewis because I don't think it's been an issue. No.
I'd just add as well, it won't be every single person that will need to be means tested, because if people are on means tested benefits such as universal credit and things, they won't be expected to do that. They'll just passported it through, they call it.
Just on that, are you able to determine whether any of our applicants, sort of who are currently going through the system, are on those means tested benefits, or is that not a question that is currently asked?
Yeah, we know that from the get-go, more or less. Referrals through from Hampshire County Council, there's a question on there on whether that person has a means tested benefit, and what we would do is when we go out to do our site survey or visit, we would double check that with the customer and then evidence that whilst we're there.
So of the actual adaptations that we do, what proportion has already got some form of identified means tested sort of qualification?
Good question. Give me a sec. Approximately 19 of our current caseload, which has been approved or completed. The difficulty being, well, not the majority of those are probably likely to be children's cases. I could go into the detail and get a bit more from that, but by the detail that we've got on our case management spreadsheet at the moment, it's 19 of those.
Is that 19 of 80 so far this year?
It would be, yes.
So what, 25%?
Yeah.
So I think obviously there are people who already got the sort of some form of means testing sort of prior to actually being presented to us. So it's not a case of every single one would necessarily need to go through means testing alone. Thank you. Any further questions on option 2? Okay, option 3. Councillor Morris.
This might be picking up on one of Councillor Hull's points. The combination of means testing applications, along with you having the discretionary grant, would, I think, make it very easy for people to perceive it as being a case of winners and losers in a system, and that it'd be very quick for people to see this would seem to be unfair. And in option 3, are there actually consistently applied transparent principles on who would receive the grant and who wouldn't? Or because otherwise I would imagine that it would be very quickly to accuse people going, this person got money for their house and I didn't get any money for this house. It's favouritism. So how would it be applied?
You can.
Thank you, Councillor Morris. So the means test itself is government mandated. So those people that weren't passported would have to do that. And that takes into account many things. It's income, it's savings. The one thing it doesn't take into account is the cost or how much a property is, but it takes into a lot of different parts to work out what a contribution would be. And then what we're suggesting we do is over the next 12 months, we do this means testing, find out how much people are generally having to contribute, and then working out where, if we can, a disregard of that contribution would sit, and that would be across the board. So let's say £5,000. If you needed works done, we did a means test on you, you would get £5,000, your neighbour next to you would get £5,000, and your other neighbour would get £5,000. So that would be equitable across the board there. But we want the data to be able to back up where exactly we need to be with that. And obviously we need to consider the budget also. So that could, for example, come out as £15,000, but we would have to consider what is affordable at that time.
So 2 applications which were effectively like for like would have the same outcome into the system.
I think that so say if I applied and Mandy applied and we both needed a level access shower and we set the discretionary amount at 5,000, we would both receive the 5,000, but the contribution we would have to make towards the rest of the work would depend on our personal circumstances. So I might have to contribute 4,000, Mandy might have to contribute not 4,500. So everybody, if we just set a discretionary amount, everybody would get that discretionary amount. The part they'd have to contribute would be dependent upon their income. So I think that would be fair, because if you've got somebody who earns a lot more than their neighbour, they would be asked to contribute more, or they have lots of savings. Does that help?
It's just whether it's whether the two neighbours in this, in your situation, would be aware of the other person's that they got this extra money off or extra grant.
Councillor Morris, they would probably be aware because people talk, and so we often go to places and you'll suddenly get a lot of people all in the same area coming to have a grant. So people do talk, so they may well be aware. But as long as we're doing it as the legislation says that we should do it. So we're using the government's recommended means test, and we are then just applying the same amount of discretion to each person, then it will be fair. Because it'll be on their own personal circumstances that we are actually assessing their contribution. So Karen said, if somebody's got a lot of savings, their contribution will likely to be greater than the person next door that may be on a very low income and not have any savings. And so it is fair. I know the only people it's not fair to is the people that are both working and quite young, and that's quite hard, which is why we're putting the discretionary part into it, so that because the government's line is that they should just borrow the money. So I think whenever you do means testing, there will be some people that just are in that tiny little bit of in the middle of it, and I don't know how we would manage to get over that really, whilst making the whole system fairer for everybody.
I'll let other councillors have a go.
Any other questions? Councillor Ashmore.
Thank you, Chair. I tend to agree with Councillor Morris, because what happens is when you give it a kind of discretionary amount, it always remains open to challenge interpretations. And I think we need to be open and honest for everything that we judge our residents. And I think it would be unfair to say that somebody gets 5K, another gets 4.5K or less, or somebody gets topped up for that. I think that doesn't make sense to me, to be honest with you. I don't understand how would you judge somebody gets some X amount and somebody gets a Y amount if both of them are facing the same problem. That's my. And maybe you have an answer for that.
They might be facing the same problem, but their individual circumstances could be very different. So I could have £1 million in the bank and Mandy might not have any money in the bank. So why should we get the same? And the means test is set out very clearly in legislation. And I think going back to the very start, that it has to be appropriate and it has to be needed and it has to be practical and it has to be reasonable before we even agree to do the disabled facility grant. If we're then satisfied that they do need it and we do apply this, everybody, regardless of their situation, say we decide £5,000, at the moment everybody gets 15 regardless of their situation, and that covers most of the costs of some basic work. We can't sustain that. If we reduce that discretionary down to 5,000, it means everybody would get 5,000. Then what they would receive from us above that would be dependent upon their income. So some people may have to contribute more than others, but that's no different if I may say safe housing benefit. You have two neighbours next door to each other, they're charged the same rent, but one earns more than the other, so one would get more housing benefit than the other. So the assessment's fair, whether they need the adaptation, and I do feel that the means test is fair. What we don't know at the moment is, I think that's sometimes referred to the jam families, isn't it? It's those that haven't quite got enough money to make that contribution, and that's what we want to assess over the next year. Is will there be sort of a middle group of people, maybe the same as the pensioners with the winter fuel allowance who are just over pension credit but don't have that income to pay their heating bill. That could be 5 families, it could be 20, and that's why over the next year we want to gather the data to understand the impact. So when we come back next year, we can actually really be confident to say it maybe only 2 families would have lost out on adaptations. If we feel that 50 families might lose out, then absolutely we might go back to the drawing board and see if we can come up with a different alternative. Thank you.
So can I clarify, under option 3, you're saying even the family who have £1 million as disposable income would get 5,000 from us as a discretionary grant?
Yes, at the moment they get 15,000.
So given that even 15 is probably too much for a family in that situation, why can we kind of see that 5,000 is valid? What sort of reasoning is there of allowing even 5,000 for a family that is in that situation?
A really good question, Councillor Mather, and some of our neighbouring authorities don't do a discretionary grant at all. We're trying to get a balance, I think, taking on everybody's points about being fair and helping those families, because the means test is quite, it's led by government and it's quite old fashioned, if I may say so. And what it would really hinder are families who are working, who may have childcare, a higher mortgage. On paper, they wouldn't qualify for anything, but we know they wouldn't be able to afford it. So we're trying to get a balance to ensure that we can assist as many people as we can without making something too complicated, because if it gets too complicated, then it becomes harder to administer.
So can I also add that because it's the large proportion of the funding comes from the Better Care Fund, whose remit is to prevent admission and assist discharge, if the 5,000 would cover kind of that stair lift or that ramp that is a thing that's needed to get to, stop somebody going to hospital. That old lady that lives in the house where there's only a toilet downstairs with a stair lift, she can stay at home. So it means that if somebody then rings up from the hospital and says we've got Mr. X needs to get out of home and they need a stair lift, we don't have to go through the means test. We don't have to. We can get over that part from there.
Sorry, just you just made some comment there, which I was going to follow up on anyway. Are you suggesting that anybody who comes to us has a requirement of less than 5,000, they wouldn't be means tested and only be means tested if their requirement was above that into the discretionary area?
Everybody would be means tested, but it means that we would give them the first 5,000 regardless of the outcome of the means test. So if the works were only 3,500, we'd give them 3,500. And then if the works were 6,000, the means test would demonstrate how much they had to contribute between the 5,000 and 6,000.
Councillor Ashwell.
The only difference between option 2 and option 3 is we do the means testing in both cases, but in the option 3, we have a option of giving them 5,000. Is that what you're saying?
Yes, so option 2 is most probably the total opposite to option 1. So option 2, all they would qualify for is £30,000 if they qualify for the mandatory, and there would be no discretionary. So that would be the harder line. Option 3 is a mixture really between option 1 and option 2. So we're looking at maybe reducing the top up down to 60 instead of 100 and having a discretionary grant lower than 15,000.
And obviously there's a balance to be had about spending our budget every year and making sure we're helping the most amount of people possible. If we strip this right back to option 2, it could be that we don't spend our budget every year.
With option 2, you won't be able to spend your budget. So
Councillor Morris.
Yeah, I'll ask whether I'm reading option 3 correctly. I'm reducing the top-up grant to 30,000. Does that mean that the sort of extensions that you described earlier for disabled children would not be able to be built without outside funds, either from the residents or from Hampshire County Council?
Thank you, Councillor Morris. So they would get the 30,000 mandatory and then another top up of 30,000. So we'll be able to help with £60,000 towards the works. If it costs a little bit more, at the moment, Hampshire, we're working with Hampshire County Council, who are often making a difference. But what Lewis and Mandy and the team do is maybe come up with a different schedule of works that will reduce it under 60,000. So sometimes and there may be I suppose I don't call it a wish list, but everything that we could possibly do. And then Mandy would look at it and think, actually, that's not necessary. That's a luxury, not necessary. And we could bring that schedule of works down so that we can still meet the needs of the family, but keep it within the 60,000. The team feel that 60,000 would be enough to maybe do a small extension or the wet room and maybe a level access kitchen.
If I can follow, you slightly confused me further with that answer. Because
That wasn't my intention, Councillor Morris.
well, no, because but if an intervention for someone, you can come up with something which is suitable for that person for 60,000. Why are we currently doing interventions which cost more than that? Surely you have a duty to the taxpayer to do the most efficient response possible.
Absolutely. And prior to March 2023, we didn't even have a cap on the 100,000. So we were doing works for one family that would cost 300,000 to 400,000. We reduced that down to 100,000. Now we feel that we may be able to reduce that down by 60, and that's where it's a forever moving feast, because the number of applications have gone up. You're quite right, it's taxpayers' money, so we're looking at how can we help more people. So that's why we need the year, because I wouldn't say we're 100% confident that 60 grand would be the right figure. And that's why we really need this year's grace to collect that data. It may be Councillor Morris would come back and think it's 75 or it's 80 or it's 100 or it's 40. But on all the applications the team have looked at, talking to colleagues, they've derived at the figure with the information that we have of 60,000, but we do accept that might have to change. But we need to gather that data to make that decision.
Yeah, that's really just an example right now. We know how much works cost, but we don't know how much we can afford to give people, basically. So that's what we need to gather this data for. We don't know the impact of getting further contributions. That might allow us to actually be able to have more of a top-up grant, because we're getting more money back from people that at the moment we're not getting any contribution from. There's just a lot of unknowns, unfortunately.
And if I may add, I think it's really important to note that owner occupiers have a charge put against their house for anything that's over 30,000. So it's in their interest that we keep the works to the minimum cost as well, because they have a charge that goes against their mortgage. And then we have the additional issue that they have to have the equity in that property to the value of the works of over 30 to the value of the work. So say if it's 60, they've got to have equity of 30,000. To start with. So that's another conversation that we often have with people, especially with families that are just starting out, because they may not have that equity in the property. So that's another difficult conversation that sometimes we have to have. So there's so many variables involved here.
If I can hold the question one more, I appreciate the variables, and if you want to do more research, and that's great. But would I be correct in characterising it, saying that the sort of stuff we're currently doing, the sort of extensions which cost £100,000, under option 3, we will no longer be doing those?
At the moment, we can go over £100,000 with if it's exceptional case and if Councillor Westwood signs it off. But it has to be, I think we've done one, Councillor Westwood, since we've adopted this policy. So I would expect that we would want something in the policy to allow for a case that would be really exceptional. But again, that would be open for discussion amongst my seniors and my colleagues.
Councillor Murphy.
Just a very quick question, which is really an observation. So thanks very much for answering all of the questions, everything. I think what's struck me is that when you come back with this next year, we would probably all appreciate more sort of the upfront explaining the terminology and with some numerical examples, because actually we've got there. But it is hard for us when you're very familiar with how these pieces all fit together, whereas for us it's we're turning our minds to it now. But no, much appreciate the answers so far. Yeah.
Thank you, Councillor Murphy, and we note that and for next time. So that year will soon fly by.
Councillor Westwood, do you want to?
Yes, so Karen actually eventually got to the point I was going to make, that there is currently in the policy, I can authorise expenditure above the £100,000 cap, and we could equally retain that into the new policy going forwards if we set the cap lower at 60,000. So in answer to your question, if it came in at 100,000 and we believe we should be supporting that, currently if it's over 100,000, I can authorise that to be spent. And I would imagine that we would keep some sort of safety net in the policy, in the revised policy going forwards. So in other words, to your example, we could actually do the £100,000 worth of work.
Okay, thank you, members, for the questions. Any debate on this paper? President Chandler.
Thank you, Chair. I think it's safe to say that we've seen tonight this is an important subject for us all. And first thing I'll say is thank you for kind of answering all questions and the detail with which you've answered them. For my sins, in reading the material prior to the meeting, I had missed the importance in the report. And clearly, as a team, you're saying it's important, the data collection activity that sort of sits under option 3, if I can kind of refer to it that way. And you've also alluded to in your answers the information that we're obviously hoping to get in the near term about the future allocation in this area as well, which again is another important data point, for this policy as we go forward. So, Chair, I'll kind of obviously defer to you on this point, but kind of allied to the question that Councillor Morris raised earlier on, I think we should be formally asking for a report back on this within the year, particularly as it relates to those two data points, the data collection and obviously the effect of the forward budget, because it's going to be pivotal then in defining the policy then as we go forward in the medium term.
Thank you. Any further debate? Councillor Morris.
Yeah, I mean, I don't like any of the options because being a councillor means having to make difficult decisions and trying to find the least worst of all three. What I found attractive about option 2 is the fact that it's a blanket response of means testing, which, although nobody likes means testing, it would be perceived as being completely transparent and fair because it's working entirely on the basis of income. Whereas option 3 would introduce a discretionary element, which I'm sure, as it is currently done, it is allocated entirely objectively and fairly. The question is whether it would be perceived by the public as being allocated objectively and fairly, because we all know that a newspaper story might say that someone's got £100,000 extension and someone else couldn't even get a ramp outside their house. So that's my sort of concern with option 3. And my other concern is just that the numbers are still nebulous, as it were. And I'd be very loath to sign off on anything where the figures are, for example, this between this and this. And so I look forward to the actual research of the data points where we can actually work out what the actual effect of this policy will have. Thank you.
Councillor White.
So I think option 3, from what you said about the balance, I think that really resonated with me. I think the discretionary grant is important to not put people off, and potentially people that have got urgent needs, like I said at the beginning, people who've got changing needs. I think that's important to know that they can get that money quickly and without any question, really. But I think, as people have said about the data, I think when you said those people that are right on the cusp of the means testing, the ones that could miss out, I think the data will show whether it's fair, how it's affecting different groups of disabled people. And so I think that will back up decision when we see the data.
Thank you. Yes, I'd just like to thank the team as always for the work that you bring to this committee. And I think suggesting or recommending a change to the policy to make it means tested and therefore, sort of we can make sure that the funding that we have is targeted to those that are most in need is a very a sort of necessary change, particularly in these circumstances. We've seen this type of thing, obviously, from a national policy point of view, but also other areas of our sort of council where we're actually trying to make sure that the smaller funds that we have are able to be used in the most wise and sort of wide-ranging areas. I think the committee's made the observation about the sort of options that we've got. I do think that the option 3 does have the downside of we're still providing to those that are probably able to themselves contribute a significant amount, are still being given an element of support. So I think personally that option 2, with a more balanced or the ability, as has been said before, to actually address some of those boundary cases and use the funds in those areas to make, you know, sort of our judgment about how that money is spent, would actually sort of be a more beneficial way of approaching this, so that we actually are making sure that all of our money is being spent on those areas of need as dictated by the means testing, and that we're not then continuing to support in some way those who have got significant means to actually get funding of this type from the council. So that's my sort of conclusion on that. But thank you very much for bringing it to the committee and sort of reflecting Councillor Chambers' request. Obviously, before this, sort of is put into practice, I'm not too sure that the actual sort of mechanism. I'll look to Simon for that, but I'm just getting a shake from the head, so I'm not sure that it will actually come back through this committee anyway. So I just want that confirmation. Thank you.
Yes, thank you, Chair. I mean, the intention, as is the normal course of events, is that the report will go to Capcom Housing next. Obviously, the helpful comments from members that have been made tonight will be absorbed into that report and will help inform the data that we're going to collect to inform the policy decision at Capcom Housing.
That was the answer I'd expected, so thank you very much. I'm getting used to the process there. Okay, right. Well, thank you, members, for your contribution on. Sorry, Councillor.
Sorry, are we being asked to recommend any of the 3 options at this point, or are we just recommending the paper itself?
My understanding is we're commenting on the options that have been presented to us, and therefore it will then proceed with those comments, as Simon just said, attached to the further sort of work that's done before it then goes to other committees within the council. Great. Well, thank you very much for that. It's taken a bit longer than I anticipated in terms of that, but I think it was a really